So good day everyone, my name is Francis Adam Mercado from BSN2B, and today I'm going to demonstrate the collecting of newborn screening blood specimen. Before we start, first we need to prepare all the necessary equipments we are going to use in this procedure. So we have here the supplies we are going to use for this procedure. First is the NBS specimen collection kit, and next is the sterile heel lancet based on the institutional preference. And next is the non-sterile gloves, cotton balls with alcohol, and the warm moist cloth. Ensure that the expiration date of the newborn screening card has not passed, and complete all the required patient information fields requested on the demographic portion of the card, and avoid touching the area within the circles of the filter paper section before and after collection of the specimen. And since oils and other materials from hands might affect or contaminate card or specimen, and do not allow water, feeding formulas, and antiseptic solution, glove, powder, hand solution, hand lotion, or other materials to come into contact with the specimen card before or after use. And next is we are going to wash our hands and wear our gloves prior to the procedure. And so now I already washed my hands and I already prepared all the equipments we are going to use in this procedure. So now I'm going to wear my non-sterile gloves before we start the procedure. This is to avoid any cross-contamination, especially on the screening card. After wearing my gloves, we are now going to position the newborn's baby's feet below his or her heart to increase the blood flow. Okay. Before we start collecting the specimen, we need first to identify the newborn's identity. We are going to warm the heel of the baby for 3 to 5 minutes to increase the blood supply of the area. So now we are going to use the moist warm cloth and we are now going to put it in the feet of the infant. So okay, after 3 to 5 minutes, we are now going, the newborn's heel is held with a moderately firm grip of the forefinger is placed at the arc of the root thumb below the punctured site at the ankle. And next, we are going to site selection. The recommended site for sampling is on the plantar surface, laterally beyond an imaginary line drawn posteriorly from between the fourth and fifth toes to the heel, and medially from the middle of the great toe to the heel. This is to prevent the damage to the bones, nerves, or tendons. And after the selection of the puncture site, the area is cleaned with cotton ball with alcohol and allowed to air dry. The air dry heel for maximum antiseptic action, approximately 30 seconds, and to prevent the mixture of the blood and the antiseptic solution. Okay, so now we are going to clean the area. This card. Okay, so now let's just wait for it to dry for at least 30 seconds. After 30 seconds of air drying the heel of the infant, we are now going to place the lancet, the base on the lancet, flat against the heel, which is punctured using a quick control stroke. So let's assume that this is a lancet. Okay. So the first drop of blood wiped off with a cotton ball or gauze and discarded as it may be contaminated with skin cells, alcohol, or excess tissue fluid, which may distort the test result. So now we are going to wipe the first drop of the blood and discard. And the heel is held in a dependent position and gentle pressure applied to facilitate blood flow. Okay, just a gentle pressure. Um, because an excessive squeezing of the heel may cause hemolysis or contamination of the specimen from interstitial fluid, leakage, and bruising. And we should, in the infant, we should observe for any indication of pain, such as behavioral, for example, facial grimacing, crying, gross motor movements, and for psychological responses, for example, changes in the heart rate and respiratory rate and blood pressure. And if any of these are observed, the procedure should be discontinued to allow the baby to become calm or provide additional comfort measures such as pacifier, rocking, or containment. Since we don't see any sign of pain, we are going to continue the screening test. As the desired specimen is then obtained in the NBS specimen collection paper, touch the first circle. So this is the first circle. Touch the first circle on the newborn screening card and gently against the large drop. So let's assume that there is a large drop from the infant's heel. So, and in one step, allow the blood to soak through the filter paper and fill the circle. Okay? But do not press the paper directly against the baby's heel. Each of the 5 circles need to be filled and saturated through. Apply the blood only one side of the filter paper. Okay, so the second circle. Okay, third, the fourth, and fifth circle. Do not apply multiple layers of blood drops on the same circle. The circles are measured and should contain a set volume of blood. Layering can interfere the accuracy of the test by providing a non-standard amount of blood or non-uniform analyte concentration. And once the blood sample has been collected, the heel is cleansed of any residual blood. Gentle pressure with a cotton ball is then applied until the bleeding stops. So now we're going to clean the residual blood. Okay. And next, we are going to keep the specimen collection kit on a dry, clean, flat, and non-absorbent surface, or you can use a drying rack and let the blood spots dry for a minimum of 3 hours, and keep them out of direct sunlight and away from other heat sources. And once the blood spots have dried completely, the newborn screening card can be sent to the newborn screening center.